Hey everyone, welcome to Future Horizons. Today we're joined by the wonderful Dr. Somabia Ibrar, a passionate and accomplished family medicine doctor, whose journey in the field of medicine is nothing short of inspirational. From her years of experience caring for her patients to a dedication to continuous learning and growth, Dr. Somabia brings a unique global perspective to the future of healthcare. We're so excited to hear her insights, stories, and advice for aspiring professionals. Welcome to Future Horizons, Dr. Somabia. How are you?
I'm good, thank you, and thank you for having me here.
It's my pleasure. Thank you so much for coming.
You're welcome.
What inspired you to pursue medicine, and ultimately, why did you choose family medicine? So, just like a little background about your journey to medicine.
And if I'm really honest, I don't even remember the time that I decided this because that's how early it came to me that this is what I wanted to do. I think I always wanted to make a difference. I do remember that. And I think medicine just felt like the right thing. It was making a difference in the right field. It meant a lot. It meant the betterment of people, and there was a lot of satisfaction to it. And I think that's what made me choose medicine. And why I chose family medicine was because there was a lot of personal relationships that you develop.
Mm-hmm.
You have children. There's a very diverse cohort of people that you see, a diverse the problems that come to you on a single day are very, very diverse. You're not stuck to one thing. But I think over the years, you see the same people grow up. You have a relationship with them. You see them when they were children, when they're growing up, their marital problems, how their health affects them when they grow up. And I think that kind of longitudinal care was something that it just meant a lot to me. I wanted to be there for the long run. So I think that's what made me choose family medicine.
You do really stay with the patients throughout their life.
Absolutely.
That's beautiful. Thank you.
Thank you.
During medical school or residency, was there an exact moment that made you realize that family medicine was the path for you?
It wasn't in med school. When I was doing my foundation program, I did a 4-month rotation in family medicine, and there was one of my supervisors, and when I used to see her with her patients and the kind of love and respect they had for her and how much of a difference she was making in their lives, I think that's when I chose that, this is what I want to do too. And I still think of her, and if I'm half the doctor that she was, I'd be very proud of myself.
It's a beautiful story.
Thanks.
How would you describe a typical day in family medicine? What's your patient load normally like in the variety of cases you see?
That's a very interesting question. I think the whole beauty of family medicine lies in the day-to-day, the mundane. You could start your day with seeing a well baby and you'll get lots of smiles and everything's good. And then the next patient that walks in through the door could be somebody who is actively suicidal and needs emergency help. And then you may see somebody who's got abdominal pain and they've got an appendix and appendicitis that you're worried about. And then it can end in somebody with eye problems, somebody with heart problems, like the diversity. If I see, I on a typical day, I see between 26 to 28 patients.
Wow, that's a lot.
That is a good number. And I think no two patients have the same problem. So, it's every single minute something completely different would walk through the door.
So there's a lot of variety.
Yeah,
That's
absolutely.
Good. What do you enjoy most about working with patients across different age ranges and stages of life?
What do I enjoy? I think you never get bored because, the variety is just a lot. I think it keeps you very in touch with the problems that, different age groups come with. So you see a bit of your future with all of the old age problems. You see how everybody in your same age group is going through different problems. When the children come to you, you know what your children might be going through. It's very, I think it keeps you very relevant and very in touch when you see all sorts of age ranges. And it's a good, diverse. So yeah, I think that's what I would say.
Nice. Are there any subspecialties in family medicine?
Yes, you can choose to, you don't need to get certified, but a lot of family physicians choose to kind of focus on one thing. And for myself, it's mental health. I do a lot of work in mental health.
So what does that normally entail for you? And is there separate training for that or?
You don't need to get separate training. When I was doing my general practice training in England, I did a little bit more work in psychiatry than what other people might do. So usually you have 6 month rotations, and I had a longer one. And then even in my foundation years, I had two separate blocks that were just mental health. So I did child psychiatry in one, I did adult in one, and then I did the Ministry of Defense one in the other one. So yeah, mental health is my forte. That's what I like to do. We see a lot. So we see anything between mild anxiety and depression. We see schizophrenia. We see a lot of these things. I feel a bit more confident when I'm kind of managing these patients. And then sometimes you do work with psychiatrists as well. So, if you, even within within family practice, you could choose to work with psychiatrists and just take on a bit more load than what a normal physician may see.
That's nice. So there's room for like other
Yeah,
subspecialties too.
absolutely.
That's nice.
There's room for you to kind of make a niche into it, divulge yourself a bit more into it.
That's beautiful. Nice. What's one memorable patient experience or case that's stayed with you throughout your career?
Neither too many to name. I think I have a lot of patients that have stayed with me. I think one of the moments that you never forget is your first death, the one that you see the first time. You're 18, 19 years old. You've never seen death so upfront, so first-handedly. And then sometimes, I mean, in my particular case, the patient was one that was not for resuscitation. And I remember he just asked me to sit with him in that time. And it was about 4 or 5 hours. He couldn't breathe. And it was one of the most painful things I ever saw. I don't think I can ever forget it. I can't forget the look in his eyes. And his son was there as well. And I'm talking about a good 15, 16 years ago. And I think I remember that night like it just happened yesterday. A lot of work that I did was in palliative care as well. That's another one of the things that I'm really interested in. And those are the times when the patients know that, the end is near. They're not going to get better from here. And during my time over there, I used to spend a lot of time talking to them, listening about their life stories, just asking them how they feel. And I think those 6 months really stayed with me as well. So these were my stories.
Nice. What do people tend to misunderstand about family medicine?
And I think that's a very good question. I think family medicine is one of the most misunderstood specialties. And the reason I say that is because I think unless you've worked in it, you don't understand the kind of burden family physicians carry. A lot of people think of us as just doing the basic preliminaries and then just referring on. That is not what family medicine is about. I think it's I feel people undervalue the burden of work that we take, the responsibility, and for us, a lot of it is about holistic care. Like, for example, if you go to a psychiatrist, they will deal with just your mental health. Or if you go to a respiratory physician, they will just deal with your, breathing problems. But with family medicine, they will be dealing with everything at the same time. You don't have the liberty to just kind of park all the other issues and just deal with what you know best. With family medicine, you have to take the individual as a whole and then make sure that their entire health and their health journey is exactly what it's supposed to be. And I think that in itself can be a lot of things. That, for example, a patient comes to me and they've got a bit of mental health problems, a bit of heart problems, a bit of gastrointestinal problems, and it is my job to deal with all of them and make sure that everything is okay and we're dealing with everything together. And I think your mind needs to be very, very open, very, you need to treat the individual as a whole to make them better rather than that one thing that you can focus on. And I think that is what people misunderstand the most, the burden that we carry on a day-to-day basis.
It must require deep understanding of like the human body as a whole.
Absolutely.
You need to know stuff in a lot of depth and how stuff connects. It's not just like focus on one body part.
One body part, and the beauty of it, that you need to do it simultaneously, like you need to do it all at once. You can't miss things, because if one thing's not working, they're not going to feel themselves or better, and often family physicians are the first point of call for everything. So even on a day-to-day basis, I see a lot of patients who don't come to me with a medical problem, but they'll come to me with social issues, if they're having problems, marital problems, if they're having financial problems. Often people, like even domestic violence and stuff, this is something that we see. Child abuse, like you name it, like it can be, family physician is the first point of contact when they want to get some help or information or something. They often come to their GPs, at first thing, and because they don't know where to go and they don't know what help is available. So you really have to keep an open mind of what can be walking through that door.
Definitely, yes. Can you share a little bit about your journey, like your med school journey, your residency, and just your overall training in general?
Of course. So I did my med school in Pakistan. I wanted to do my foundation program in England. So what I did was, at that time, I wasn't sure if I was going to get in, if, how the journey was going to be. So I did 10 months in Pakistan for health shop, and then I took a break because I wanted to join as an F1 by choice. So then I applied and I got in. So I started again F1 in England. At that time, I wanted to be a child psychiatrist, so that was my initial interest. So I did 2 years of foundation program then in England, and then in foundation program you go into different specialties, and I realized psychiatry was one thing that was interesting me, but I also liked rheumatology and dermatology, and I didn't quite want to let go of medicine, because with psychiatry you are dealing mainly with psychological issues. So I wasn't quite ready to let go of medicine. So I initially then went into internal medicine, so the core medical training, and I did a bit of that, but I realized that I had a young family. They needed a lot more of me than I could give whilst doing internal medicine training. So at some point I decided to make the switch to family medicine, because at that point when I was choosing it, I realized that family medicine was something that was encompassing everything. I could do psychiatry, I could do bits of internal medicine, and I could do all of it under the umbrella of family medicine.
It covers all your passions in like one.
Exactly. You don't have to let go of anything. And then it was about the longitudinal care that I talked to you about, and then there was this other doctor that I had seen, and and I was like, okay, this is something that I can do. And the best part about it was that it was actually quite conducive to your family life as well. Like my children would see more of me. It was it felt like a good idea at that time.
Definitely. Thank you. How was working in the British healthcare system?
It was amazing. I even when I was a young child, because I grew up in England, I knew that I wanted to come back and I wanted to work for the NHS, and I wanted to train in the NHS. I think the training was amazing. I think they make you really good doctors. I think they do put you under a lot of kind of stress to make you shine eventually. And I think the way they teach, the guidelines and everything is amazing. So I think a lot of what I am today is just because of how I was trained in England, and I really, obviously I've only done my training over there, but when I look around, I do believe that NHS was, or the British healthcare system was one of the best that trains you.
I'm glad to hear that. Yeah. What made you move to Canada?
I think it was a decision that we did as a family. So my husband is a psychiatrist, and I had 2 children, and I think after a certain while, and I say probably in the last few years, I felt that the work-life balance that England had to offer, especially after I had completed my postgraduate training, it wasn't what I was looking for in life. I wanted to be more flexible in terms of what I do in a day-to-day basis, how my hours were, how much remote work I did. And I think a very cardinal part of what I identify as, apart from being a doctor, is being a mother. And I really do enjoy that part of my life as well, and I want to be there for my children. And I just felt that the work-life balance in England eventually became such that I wasn't able to be there as a mother as much as I would have wanted to. And I think Canada was one of those things that offered a very different, there was more flexibility and there was more choice in how you wanted to structure your day. And I think that was one of the things that made me make the move. And again, a little bit for experience, a little bit for adventure, all of that came with it too.
Work-life balance is key.
Work-life balance is absolutely key. And I think for a working mother, it is even like, I think this, if you ask any working mother, I think they would say this, that, how much, because, when you're at work, you're expected to just be at work as if you have no other job in the world. But when you're back at home, the expectation of you is that you need to be, the best at what you do at home as well. So we are divided in a lot of places, but every place expects us to do our absolute best. And there's only this many hours that you have in a day, and then you need to make the most of them. So, not just work-life balance in terms of hours, it's about what you can give, how much present you are. Are you your best self when you are giving that? All of that kind of encompasses, who you are as an individual, what you have to offer. And I think that balance, attaining that kind of balance is what I was looking for when I made the move.
Definitely. Great decision.
Thank you.
What do you like to do to unwind, to de-stress from the stressful day as a doctor? Any hobbies?
Oh, absolutely. I think I do a lot of things to unwind. I absolutely love spending time with my children. I really enjoy their company. I love talking to them. I like doing everything with them. So that's one thing I do. I do like to cook. I love to host. So I do host a lot. And I think it just gives me a break from what I do at work and just, kind of be just a random next person. I love to write. So I write a lot. I'm currently in the process of writing my own book, which is the kind of challenges I faced, to be where I am today. And I think, and at other times I read as well. I do love to read as well.
Nice. Do you have any book recommendations?
Do I have? Oh, I've got loads. I'll probably link them in the end, because if I start listing them, it would be too much.
Yes, definitely. And I'm excited to read your book.
Thank you.
Yeah. What advice would you give to high school students or college students wanting to pursue medicine or family medicine?
The advice I would give is that this is a profession that does take a lot out of you. So you need to do this if you're really, really passionate. It's one of those, regardless of what people say, and I think it's not one of those things that you can completely switch out of. Like, your patients may need you at any time, any hour. There's going to be a lot of heartbreak. You're going to see a lot. And I feel that it's kind of a way of life. It's just not just a profession. And if you're going into it, you need to have that passion. You need to have that understanding that it's taking your weekends and your holidays and your, God knows what, the hours it takes in your day. And, you'd be waking up thinking about patients, and you just can't kind of let go. You need to know that, is this what you want to do for the rest of your life? And if you find that, this is your passion, you've got it in your heart, then don't worry about the small adversities that come. Don't worry about the small obstacles, the small hiccups that you will face in your journey. You go into it thinking that what, you're going to achieve in the end is going to be so much, greater than anything that you've ever known, that it will make it all worth it. So if you've got the passion, go with it. Go in it with all your heart.
Thank you so much for your advice.
You're most welcome.
And thank you so much for coming onto our podcast.
Thank you for having me. It was such a pleasure.
Thank you.
Thank you. Bye.
Bye.